Namaskar, I am Dr. Supriya Deshmukh, a board certified dermatologist, cosmetologist and trichologist based in the city of Thane. I would like to touch upon the topic of how Indian skin ages. Well, all the skin ethnically are quite different. We are quite different from a Caucasian skin, that is people staying in Europe or America. We are pretty different from people who are staying in Oriental countries. Now, how do we differ from their skin in terms of aging? So the thing with Indian skin is we have good amount of melanin inside us. That's what gives us our color. Now, melanin is a protective element against aging. Yes, I know most of us don't like our color, but the thing is it helps us in preventing aging. Aren't you surprised to know this? Now, if our melanin is unevenly distributed, then it can be evenly distributed with the help of certain treatments, which will make you look even and younger. However, when aging starts in Indian skin, it is usually due to lack of certain dietary practices. Generally, the Indian diet is a bit low on protein. So, Indian skin starts to age because of lack of protein. So when first signs of aging appear on skin, they are usually pigmentation, hollowing on the skin, that is because of loss of volume in the skin. So you start seeing certain lines here and there. And third thing is when there is a lot of significant sagging and wrinkles. However, as Indian skin, we wrinkle very late, but we start to pigment very fast and we start to develop hollowing quite fast. Now, how to fix this? There are ways and means to fix this. The first thing or the first step to anti-age is to visit a qualified person. Do not visit your parlors for anti-aging advice. Do not visit your neighboring drugstore for anti-aging advice. The first step in anti-aging is a robust skincare regimen which is to be followed at home. Maybe some prescription drugs or supplements which will enhance your skin. And third is a good high protein diet. Now, there are some people who do not get quite satisfied by just doing this. They want something more. They want to anti-age more. Then you need to do some procedures for the same. The first procedure would be evening out your skin tone, which can be done with help of chemical peels or Q-switched NDI laser, which will help even out your skin tone. What's the second procedure? Well, if you have wrinkles which are coming onto your forehead, it's giving you a frown line look, or you must have heard of things such as crow's feet, and they do bother you, then those can be fixed by a procedure called as botulinum toxin. It's also popularly known as Botox. So botulinum toxin, when injected into these muscles, they just relax the muscle, causing the wrinkle to disappear. Now, many people ask me, Doctor, does Botox, will it make me look artificial? Well, the answer is no, not really. If you go to a right person and if it is done in the right proportions, then you'll really look anti-age without looking artificial. So the skill is in the hands of the provider who you go to. There is a third modality which also can be used for anti-aging, which is called as a filler. You must have heard of something called as dermal fillers. Well, these are nothing but hyaluronic acid gels. They come in pre-filled syringes, and these gels are just placed at the right points in your face to enhance certain features on your face, like giving you a high cheekbone or enhancing your nasal bridge, or putting it a bit on top of your eyebrows so that your eyebrows are lifted. It can be put in your chin so that your chin is more prominent, so on and so forth. And there is one more revolutionary technique to anti-age, which is called as thread lifting. So thread lifting is nothing but we put threads inside the skin from the hairline and it's pulled up to remove the sag from the skin. This is more revolutionary, gives very drastic changes and is very safe if done at the right place. So thread lifting is the fourth and another non-surgical way of anti-aging. So for a perfect anti-aging advice that is tailored to your requirements, you must visit a dermatologist and get a plan for yourself. Thank you.